Hi, my name is Danielle and I'm the nurse today. I'm going to be doing an assessment on an infant. So we have our infant here. First thing we want to do is go ahead and get the vital signs. So we'll get the blood pressure, we'll get a temperature on our infant here. We've already got the blood pressure, it's normal. You can do an axillary temperature and that looks normal as well. Get the pulse ox on the baby. We want to go ahead and assess the head first. So we'll take her hat off here. We'll feel for the anterior fontanelle. We can feel the soft spot. We can follow the suture line back, the posterior fontanelle. Look at the ears, make sure they're intact. If there's any bruising on the head that's normal from birth, we can look at the eyes, nose, mouth. There may be some milia on the nose and the cheeks or chin that's normal. We can see if the baby reacts to light. Okay. If they're crying, we can really assess their mouth and their tongue and things like that. If they are crying, we can pick the baby up and try to soothe them. We can use nonverbals with the baby. We can talk softly, quietly, speaking in a soft voice with the baby. And with supporting the head as well. So next thing we want to do, we can also check the reflex on the cheek by brushing our finger against to see if the baby moves their mouth or opens their mouth when we do that. We're going to go ahead and undress the baby, and they may start to cry when we do this, but like I said, we can use some nonverbal cues and soft voices and try to soothe the baby and calm them down. We could check the clavicle here, make sure that that's intact. We want to look at the skin of the baby, the color, make sure that they're pink. They may be cyanotic on the arms and legs or hands and feet. They may be a little bit cyanotic, and that's normal for birth. We want to go ahead and listen to the heart and lungs, and the stethoscope is very large for this baby, but we'll do the best we can. Try to listen to all 4 areas on the lungs. And if they're crying, that's good because we can really hear those lung sounds a lot better if they are crying. And we want to listen to all 4 sounds, or all 4 areas, sorry, on the posterior. Okay, and we'll listen to the heart rate for a full minute using 8 to man, so we can listen to all 4 areas on the heart, making sure we don't miss anything. Making sure there's no murmurs or anything like that. While we have our stethoscope out, we can listen to bowel sounds before we palpate. So we want to start in the right lower quadrant. And work our way around. Okay. And then we want to go ahead and we can palpate the abdomen, making sure there's no distension or any lumps or anything like that. We want to feel for the brachial pulse. We want to test the grasp reflex and see if they can grasp our finger. We can kind of pull up on the baby a little to test the head support. And we want to look at the legs. Look at the feet. We can get the femoral pulse on the baby here. Okay, and then we'll test the Babinski reflex by brushing our hand on the foot and seeing if the toes flare out, which they do. That's normal and good for a baby. Lastly, we want to check the range of motion on the baby as well, making sure that they're active and moving and responding to stimuli. Then lastly, we can check the genitalia. This is a female baby, so we want to make sure that there's separation of the labia, and there may be some discharge or mucus, which is normal. We want to assess the anus and make sure that that's intact, which it is here. We want to look at the back side of the baby, okay, and check the spine, make sure the spine's straight. We can also lift the baby up and check the stepping reflex of the baby. Okay, and everything looks good. So we can go ahead and swaddle our baby back up because they may be crying at this moment from us assessing them. But we will go ahead and document our assessment, and if there's anything we need to report to the provider, we will do that immediately. And that completes our assessment, or head-to-toe assessment on an infant.